Hi. So we keep seeing many people suddenly succumb to heart attacks, strokes, many times even in the young patients. So how to know the risk? Because once somebody has a heart attack and a stroke, many people suddenly die of heart attack, some people get intervention, get angioplasty and get recovers. In the stroke, if it is severe stroke, many months power may not improve, lot of suffering. So how to know the risk? I'll tell you some 6 important parameters. If you know it at least on a yearly basis, if you monitor it, you know that what is your risk. And this will be preventive. I see in my clinical practice many people do the whole array of blood tests, which includes many things. But in that you should know which is more important, which gives some clue that there is a possibility of getting heart attack or a stroke. The first basic thing is your BP and waist circumference. So keep your BP less than 130, less than 80. To the maximum, less than 140, less than 90 is ideal. And many times what happens, you don't need to check your BP always in the clinics. Nowadays there is many good electronic BP papers available, home run and so. And make sure that check your BP at home only. Preferably once you get up in the morning, you're relatively cold, and in the night before sleeping. And monitor BP and at home, whether it is consistently, if it is showing high, meet your doctor and address it accordingly. And don't check your BP immediately after food, after exercise, after coffee, TV. It may give some little high readings. So this is about BP. Second thing is a waist circumference. So this waist circumference is very important because the most dangerous fat in the body is the visceral fat. That is the fat over the abdomen. That fat which deposits over our organs like liver, pancreas, and that thing. This is the most dangerous fat. So if you know the normal waist circumference, at least approximately you have less fat. For example, for men if the waist circumference is less than 90 centimeters, there is a less risk. For a woman if it is less than 80 centimeters, that is a less risk of any future complications and have good metabolic health. And you want to measure this waist visceral fat more precisely. You want like what percentage of visceral fat I have, all those things you want to have. Then you can go for a whole body DEXA scan. In that you can exactly measure, in the gyms people go and measure what is the fat percentage. There are some machines, and most of these machines are actually not so accurate. And they will give you a slip that you have so and so fat percentage in so and so body. That may not be accurate. If you go for a whole body DEXA scan, that will give a very accurate reading of the fat percentages in different parts of the body and also in the abdomen. So these two things are clinically, everyone knows whether you go as a part of your health checkup or if you go to gym and exercise, keep a note of it, BP and waist circumference. Second thing is HDL, that means the average sugar of previous 3 to 4 months. So this is commonly found in many of the health checkups. If it is less than 5.8, it is relatively good. At least to the maximum, keep it less than 6. That's good. And HOMA-IR. Many people are not aware, but I explained in the previous video. HOMA-IR indicates insulin resistance. Insulin resistance is one of the important risk factors for a heart disease. Many people think that it's always the cholesterol is a risk factor for heart disease. 50% of people who get heart attack are normal cholesterol. More than cholesterol, it is the insulin resistance that drives a risk for heart disease, that is measured by HOMA-IR. It's a blood test, and if it is less than 2, it is fairly good. And second is ApoB. And when you see in a lipid profile, in a cholesterol report, many are aware of this bad cholesterol, LDL. Many are only knowledgeable about bad cholesterol is high, then you have a risk factor. Actually it is not. LDL has 2 fractions, small density LDL and a large density LDL. And large density LDL is relatively harmless. And in the lab parameters, what we really do, we cannot differentiate between small LDL and big LDL. So for that, to know the exact risk of the burden of plaque, check your blood test Apolipoprotein B. And this will give very precise information than LDL about the risk of heart disease. If Apolipoprotein B is less than 80, it is fairly good. And next is Lipoprotein A. This is also done in most of the routine health checkups, what I see. And this is especially in the families, like where there is a cardiac problems in the head, sudden heart attacks, strokes in the young age, around 30 years, 40 years, because of genetic influence. In those people, if this is high, this that's especially useful for them. If this is above 30 or very high, that indicates a risk for a cardiac issues or a stroke, and such people can go for a CT coronary angiogram and so to know the risk and rule out the blockages. And the last is CAC score, it means CT calcium score. This is a non-invasive test. Unlike CT coronary angiogram, you need not go for a fasting, contrast agent and all. Non-invasive test, they just take a CT scan and they give a scoring. So 0 scoring is the best, and at least if the Q score is above 100, there is definitely a moderate to high risk of getting into heart attack or heart attack basically. So these are the 6 important parameters. One is BP and waist circumference, HbA1c, average blood sugars, HOMA-IR which indicates insulin resistance, Apolipoprotein B better than LDL, Lipoprotein A than 30, and CAC more than 100. In addition, in your lipid profile, your triglyceride HDL ratio is high. Even that's also a high risk factor for this one. So mention it. Along with this, there is a triglyceride and HDL ratio. If this also high, then also have high risk for a heart attack or a stroke. So whenever people are high risk, at least above the age of 40 years, get this blood parameters at least once a year, and this is CA score at least once in 2 years. That's it.